health leaders here saying that we are in a different place than we were several years ago and that the pandemic game has drastically changed. Doctors here saying we will be in a national crisis if we can't keep kids in school and businesses open. Here at a news conference that ended just a short time ago, experts saying that those eligible to get the vaccine need to do so to protect themselves from COVID and the Delta variant. Right now, children under 12 are not eligible to get the shot. Doctors say it's spreading faster and is more dangerous, and all of us should put kids first.
Impacted their mental health. I am tremendously concerned as we go into another academic year that we could lose another year of normal, what could be normal school, normal socialization for those children. So that's why it is absolutely imperative that anyone who's eligible for the vaccine gets vaccinated, and that we strongly move towards full masking, especially indoors and especially in schools. There is zero downside to wearing a mask. That's what makes it so difficult to reconcile in my head. I know people have opinions. I know it's been politicized. There is no downside to wearing a mask.
And the doctors telling us they would advise any school district that has made mask wearing optional to reconsider that policy. The Columbus Public Health Commissioner, Dr. Mysheika Roberts, applauding businesses that are now requiring masks in the workplace. Roberts tells us if state law would allow, she would order a mask mandate. Instead, Roberts strongly recommending mask wearing indoors and also outdoors at events like concerts and football games where people are in close proximity. Now, doctors telling us if people don't get vaccinated and don't wear their masks, they're concerned COVID will mutate again and the situation will become even more dire. In downtown Columbus, live, Luann Stoya, ABC6 News.
Officials here on OSU's campus say they are looking forward to a more normal start to the school year. But to make that happen, they are asking all students, faculty, and staff members to give their vaccination status to the university by today. And here's why.
That will give us the best possible data, and we'll use that data through the fall and probably into the spring to make decisions about health and safety protocols on campus.
University spokesman Ben Johnson pointed out OSU is not requiring the vaccine, and OSU says it won't share the vaccination information. The university uses the recent change with bringing back mask requirements for everyone indoors on campus as an example of how health guidelines can shift.
At some point, we may need to change that. We may need to add additional restrictions, or we may be able to lift restrictions. And we'll look at a lot of different data points. We'll look at the rate of transmission. We'll look at the positivity rate on campus. But one of the most important data points will be the percentage of our population that's vaccinated.
The university says more than 73% of the campus community has already reported it's fully vaccinated. And a testing plan is in place to monitor the spread of the virus after the semester begins later this month. For those who don't meet the vaccination status deadline, the university says it will just keep sending them reminders. In the meantime, vaccination clinics like the one here at Jesse Owens North will continue into the start of the new school year with extended hours. On your side on Ohio State's campus, Mike McCarthy, ABC 6 News.
At San Francisco's Vesuvio Cafe, it's been both a detraction and a draw.
Makes me feel safer as a customer.
Its new policy to require vaccines catching others by surprise.
I have it, but I don't have it with me.
Here, patrons without a vaccine card can leave or sit outside.
I won't come back here.
New York City now requiring at least one dose of the COVID-19 vaccine for workers and patrons for indoor dining, indoor entertainment, and indoor fitness facilities.
The voluntary phase is over. It's time to mix mandates into this approach everywhere to defeat this enemy.
New York Mayor Bill de Blasio predicting that while New York City is the first, others will follow. Los Angeles now considering similar measures. Juliette Kayyem, the former Assistant Secretary of Homeland Security under President Obama, is pushing for a no-fly list for unvaccinated adults, which she calls an obvious step the federal government should take. But scenes like this one at Idaho State House recently are also growing more common. One chief complaint is that the vaccine doesn't even have full authorization by the Food and Drug Administration. TV host Dr. Drew in a tweet comparing it to modern-day segregation, since just a little more than 28% of the Black community have received the COVID vaccine. Others likening vaccine mandates to the history of forcing people to, quote, show their papers.
During slavery, post-slavery, as recent as, what the immigrant population has to go through here.
Now we're learning of yet another idea to compel people to get the shot. Hit them where it hurts, in the wallet. The Affordable Care Act already allows health insurers to charge smokers up to 50% more on their plans. Now, the unvaccinated could be charged more on their premiums as well. In Washington, I'm Christine Frizzau.